Welcome back, everyone. Well, as the temperatures rise outside, a lot of people go outside, maybe soak up some rays. I know I do. I've already laid out a few times by the pool.
It can be bright, as we say here in East Texas.
It can be bright,
It's
though.
bright outside. Dr. Josh Hooper from Trinity Optical joins us in the living room to talk about UV rays and how they can damage our eyes. Nice to have you here.
Welcome.
Thank you. Appreciate it.
Welcome. So tell us how, I know this might be a redundant question, UV rays, how do they damage our eyes?
Well, they can damage it specifically in a few ways. There's three forms of UV radiation. UVC is the most intense, but it's absorbed by your ozone the ozone layer of the atmosphere, so it really doesn't damage us. UVB rays are also very intense. Most of those are absorbed by the ozone layer as well. However, those can damage your eyelids and your cornea and your conjunctiva, so we worry about skin cancer with those. UVA is the most frequent cause of eye problems. It can penetrate into the eye and can help lead to cataract formation and also retinal disease.
Oh, wow, that's pretty intense. Now, obviously you suggest wearing sunglasses while, I like to lay out in the sun. How dangerous is it not to wear that protective eyewear?
Well, even on cloudy days, there's still quite a bit of UV radiation, especially in the summer. The closer to midday is the more intense the sun angle is to the earth, so therefore there's more UV radiation at that point as well. You want to wear hats. I know getting a suntan is not conducive for a hat, but the hats actually protect the eyelids better. But you just want sunglasses that cover both your eye and the skin around your eye as much as possible, maybe even including a wrap as well.
Now, we often hear about cataracts, especially in older East Texans. Is it uncommon for young people to get them as well, simply because of too much exposure to UV rays?
If you have a very high exposure rate to UV radiation, say if your job is outdoors quite a bit and you haven't used sunglasses or hats most of your life, it is more common to see maybe patients in their 50s or early 60s develop those, but your vast majority of patients develop cataracts in their late 60s or early 70s.
So choosing sunglasses, what are some of the most important elements when you're thinking about choosing the right pair of sunglasses?
Well, fortunately, most sunglasses that are sold and that you can purchase have UV protection in them, so it's not a big concern. I would say if you purchase sunglasses and it doesn't say on the label or the tag it has UV protection, probably buyer beware. So what you're really going to look for is comfort. You want a pair of frames that you are comfortable in, that way you wear them more often. And also, again, the larger the frames, probably the better. That way it covers the eyelid skin as well as the eye itself.
Do the sunglasses lose that protection? I'm curious. I always hear about it. Of course, I think of bulletproof glass losing its protection over the years. Not that anybody's going to be shooting your sunglasses, but do you worry about that, or are they good to go as long as you keep? Usually, I lose mine before they wear.
There are some coatings on spectacle lenses that will wear out over, say, 2, maybe 3 or 4 years. However, with the UV protection, unless the lens is scratched, it's going to maintain good integrity.
Well, I'm going to scratch them or lose them.
Yeah,
That's going to happen.
Mine always break. Well, what about quality? Buying a pair of glasses at the dollar store versus buying like a designer name brand, does it really matter?
If you buy them at a good optical shop, there's no concern. And again, even the glasses you may buy at the dollar store or the gas station, they're probably going to have UV protection. It's going to be labeled if it does. So again, if it doesn't label it, it probably is not there. However, if you have a pair of glasses that you have a question about, you can take them to most optical shops, including ours, and there's an analyzer that they can do for you to actually determine if UV protection's in the frame, in the lenses. And also, most of your clear glasses have UV protection as well. So the frame and the lens does not have to be tinted. Well,
if you want to know more about if you have questions about this, these are the people to call. Trinity Optical, and the number there on your screen, 903-531-4733. Dr. Josh Hooper, always nice to see you. Thanks for coming in.
Appreciate it.
Thank you so much.
Nice to see you.
Yes,
A native East Texan right here.
Oh, yeah.
From Center, Texas.
Center, Texas, right there.
Thanks a lot.
Thanks.